Hiya, I'm Teoh, obstetrician, gynecologist, and fertility specialist in Perth. Has been a while since I've done my last video. Has been busy. A lot has happened for the past few weeks, and I could be churning out 2 or 3 videos this morning if I can. The first thing I'm going to talk about is embryo transfer. Recently, it is encouraging to hear that the success rate for my patients, the patients which I've done embryo transfers, the success rate is pretty good. I was told 9 out of 9 of them got pregnant, 7 out of 7 in another uh, transfers day. Disclaimer, these success rates are not always the case. On a good day, everything goes smoothly, of course, can reach a very high success rate, including sometimes 100%. The pillars affecting embryo transfer success, as mentioned in my previous video, I think I call it juice trio or something, will be 3 factors. Number 1 is the environment of the uterine cavity, how how well prepared we are in creating this perfect environment or the optimal environment in the endometrium, in the uterine cavity inside the womb to receive the embryo. Number 2 is the embryo quality, and of course the genetic of the embryo's chromosome, which is the genetic composition of the chromosomes. And the third thing is the embryo transfer technique. Now it is worthwhile to know that when a particular group on that day or a center has a very high success rate, what you can know is, for example, on certain days, me or any of my colleagues doing embryo transfers, if that group, that team always have a very high success rate, then look at least the technique of embryo transfers, preparation of the embryos, the ultrasound, and the technique where you put the embryos back would be of a high quality, of course. In Junior Hollywood, we always use ultrasound scan to do our embryo transfer. I'm going to show you a clip of what we see on ultrasound scan on how the embryos being replaced or transferred into the uterine cavity. We ask our patients to try to have a full bladder because the bladder acts as a window for us to see the uterus clearly, and also sometimes a full bladder can push and straighten the womb, the uterus essentially, and that makes the technique of putting the straw in a bit smoother. When it's easier and smoother, it's always better for the environment for the embryos to stick on. Towards the very end, when we do ultrasound scan, often we see a bright bubble which contains the embryo in the uterus. I call it our shining star. Hopefully it sticks on, grow into a healthy baby for us. Here you go, that's the video. This patient has a full bladder, which is great for transfer. This is a good scan as we can see the lining very clearly, which is where we are aiming for to place the embryo gently in that perfect position. The next thing is we place the outer catheter to get ready for the inner soft straw for the embryologist to bring it to us to put the embryo, again aiming for the endometrium in the middle there, the perfect place for the embryo to live in. Here we go, the inner soft straw going in, and gently we're going to place the embryo in there. Wait for it. Here we go. Here we go. Our shining star hopefully sticks in there, grow into a strong and healthy baby for us. As you can see in the video, we are aiming to place the embryo very gently in that perfect place in the endometrium. Believe me, actually that video actually was slowed down a little bit. The process actually only takes a few seconds if it's going well. The reason is because when you get the embryo, you want it to go back in the warm, perfect environment as soon as possible. So you don't want to muck about for too long. And that's about it this time. I'll see you in the next video. Bye bye.